Today we are diving into a really serious topic, one that's way more urgent than most people think, the diabetic foot ulcer. And believe it or not, our entire story today starts with just one single number.
1. But this isn't just a number, it's a countdown. Every 30 seconds, somewhere in the world, a person loses a limb because of a diabetic foot ulcer. Think about that. That's 2 people in the time it takes you to just brush your teeth. It's a shocking statistic, and it's exactly why we need to talk about this, and more importantly, how to prevent it.
Now, the material that's made this whole explainer possible comes from the incredible work of Dr. Abdul Karim Iblasi from the 1-year Wound Care Diploma, so a huge thank you to him. And just a quick heads up, think of this as a helpful guide to lock in the main ideas. It's a great resource for sure, but it's not a substitute for attending the lectures.
So, let's get right into it. To understand how to fight this, we first need to understand the threat itself. What are we really dealing with here?
So, a diabetic foot ulcer, or a DFU, it's not just a scrape or a simple cut. It's what we call a full-thickness wound. It's a serious breach in the skin's defenses. And for someone with diabetes, this isn't a minor issue, it's a major medical event that can spiral into infection, amputation, and yes, it can even be fatal.
And look at this. Just let that sink in for a second. The 5-year mortality rate after getting a DFU is higher than it is for many well-known cancers. This really drives home the point that this isn't just about saving a foot, it's about saving a life. So, how on earth does a break in the skin become so dangerous?
Well, to answer that, we have to look inside. The problem isn't just the wound. It's the conditions created by diabetes itself. It's like there's an enemy working from within. It really boils down to 3 main culprits. First, you've got peripheral neuropathy. This is nerve damage. It's basically like the body's alarm system has been shut off. A person can step on a nail or have a rock in their shoe all day and not feel a thing. Next is peripheral arterial disease, or PAD. This means poor blood flow. Healing needs a good supply of oxygen and nutrients, and PAD is like a roadblock on the highway, stopping the repair crews from getting to the site. And third, with that broken skin barrier and a weak supply line, you get infection. It's just an open invitation for bacteria to come in and wreak havoc.
Now, to understand how bad an ulcer is, there's a system called the Wagner classification. But let's simplify it. Think of it like a staircase you never want to climb. Grade 0, you're on the ground floor. The skin is intact, but it's at risk. Grade 1 is the first step, a shallow ulcer. Grade 2, you're going deeper, down to the tendons. By grade 3, you've hit bone. And those top steps, grades 4 and 5, that's gangrene. That's tissue death. And that's when amputation becomes almost unavoidable. The whole point of prevention is to make sure you never even take that first step onto the staircase.
Okay, so that's the scary part. But this brings us to the most important part of this whole story, the solution. How do we fight back? Well, our best weapons, by far, are prevention and really smart, proactive care.
And that standard of care rests on 5 key pillars. You've got debridement, which is clearing away dead tissue, dressings to protect the wound, vascular assessment to check the blood flow, and glycemic control, keeping blood sugar in check. That's the foundation for everything. But then there's offloading. This means taking all pressure off the wound, and this one is absolutely 100% non-negotiable. You could have the most advanced, most expensive dressing in the world, but if a person keeps walking on that ulcer, it is never going to heal, period.
Now let's zoom in on one of those pillars, the dressings, because honestly, this is where the technology has gotten incredibly cool and made a huge difference.
You know, for the longest time, the go-to was just dry gauze, but we figured out that was all wrong. Wounds actually heal much better in a moist environment. So modern dressings, like hydrogels, create this perfect, humid little world for the wound. They don't rip off new skin when you change them, and they can even help with the pain. This shift from just covering a wound to actively creating a healing environment was a total game changer.
But of course, the innovation didn't stop there. People started asking, what if a dressing could be more than just a good environment? What if it could be an active player in the healing game?
And that led to this amazing new arsenal. We now have dressings that actively fight bacteria using things like silver or medical-grade honey. We have composite dressings that lay down a scaffold like collagen to help new tissue build itself back up. Then you get to the really wild stuff, bioactive dressings that use stem cells or platelet-rich plasma to literally supercharge the healing process. And looking ahead, we're talking about 3D printed skin, smart bandages that tell you how a wound is doing, and microneedle patches. It's incredible stuff.
But here's the thing. All of this amazing technology,
From a simple hydrogel to a 3D printed graft, it's all designed to do just one thing: help the body do what it already knows how to do. It's about supporting the body's own amazing, natural healing process.
That process happens in 4 stages. First, hemostasis. The body stops the bleeding. Second, inflammation. The cleanup crew arrives to fight off any bugs. Third, proliferation. This is the rebuilding phase, laying down new tissue and blood vessels. And finally, remodeling, where that new patch is strengthened and reorganized. In diabetes, this whole beautiful process can get stuck. And all those smart dressings we talked about, they're designed to give the body the push it needs to get things moving again at every single stage.
So, when you see how smart our technology is getting and how much better we understand the science of healing, it leaves you with a really hopeful question. With this modern arsenal of treatments and a huge focus on prevention, could we actually live in a world where that number we started with, 1 amputation every 30 seconds, finally becomes a thing of the past? It seems like it's not just a possibility, but something truly within our reach.